Sleep apnea will take 5 to 10 years off your life. What snoring is the tongue collapsing against the back of the throat. Sleep apnea, if it gets stuck there, this is obstructive sleep apnea. There are different types of sleep apnea. When I say sleep apnea, I mean obstructive sleep apnea. Stuck there 10 seconds or more, 5 or more times per hour is the lowest bar for mild. Up to 15 times per hour is still mild. If you grab a pulse ox off Amazon for $15 and try to get your pulse ox below 90, I guarantee 99% of you won't be able to do it. Maybe some divers, stuff like that, you might be able to push it. If you were in the hospital and that happened, you'd code. So they'd be in there with a cart. Imagine that happening 15 times per hour every night. Sleep is one of the #1 things that will increase your lifespan. If you can't sleep well because you can't breathe, you're gonna take 5 or 10 years off your life. There's one dental treatment for sleep apnea. There's 3 medical treatments. I really don't care which one you get. On the medical side, you've got surgically opening up the airway tube to make it bigger, take out adenoids, tonsils, things like that. Some people are candidates, some people aren't. 2, you've got something new the last couple of years called Inspire. Goes in here, turn it on like a little key fob at night before you go to bed, stimulates the airway open. My father-in-law's got it, he likes that. I have a buddy who did the airway opening surgery, a lot of patients who have. It's gonna be hard to swallow for a couple days, but then it's gonna be great. Option number 3, most people know about it, the air mask, positively pushing air down your throat so that your tube stays open. Option number 4, the dental option. They all work the same way. They all hold your lower jaw forward. It opens up the airway, keeps the tongue from collapsing against the back of the throat. Again, you can do this yourself at home. So you want to breathe in through your nose. Nasal breathing gives you more oxygen for a number of reasons, but you want to breathe in through your mouth for this. So if you breathe in through your mouth and then you open up your jaw and slide it forward and breathe in again, you can feel how much more air gets in there. So that's all the dental appliance is doing. It's holding the tongue forward, pulling it off the back of the throat, opening up the airway so more air gets in, the tube can't collapse. That's good if you have sleep apnea. What's better is if when your child is around 8 to 12, they're properly evaluated by a good dentist or pediatric dentist or orthodontist for jaw growth and development. So the roof of the mouth is the floor of the nose. A lot of people, their jaw doesn't develop as much as it should. And there are appliances that can be given at any time in life, but are great during that 6 to 12 period to help develop the jaw. So the roof of the mouth is the floor of the nose. The wider it gets, the more nasal breathing you will get. And that is superior to breathing through your mouth. So that's something that can be done at any time by a dentist to develop the airway and the jaws. I'd recommend that if your jaw is restricted. The dental appliance can also be made to hold the lower jaw forward.